So beginning to look at some of the pathologies associated with the neurological system, you have your cerebrovascular events, and your two main things we're looking at there are stroke and aneurysm. So when you look at any type of cerebrovascular event involving the central nervous system and in the brain, one of the things to note is that the signs and symptoms are going to be based upon what areas of the brain are affected by the respective vessels. So when you're looking at, both of these incidences involve situations where blood supply is going to get compromised, but for different reasons. So with the stroke, it gets compromised because of the embolism or the clot that forms, and whereas with the aneurysm, where you get the weakening in the blood vessels, so you can see each of these on the pictures, the blood vessels end up bursting, and in addition to getting those areas not getting blood supply, you also get bleeding that will compress the brain when you have the aneurysm occur. One of the things with the stroke that causes a lot of the prolonged disability is the secondary hypoxia. So the lack of oxygen to that area of the brain, which is going to cause cells to die in that region. And again, depending upon the area of the brain that's affected, it's going to affect certain functions that the individual would have. With both of these, there is a very large potential for substantial disability. So again, note your signs and symptoms with each of these. Because you can, a lot of times, if strokes are detected early, you could limit some of that long-term disability if the person gets prompt treatment. Part of the issues with aneurysms is that many times individuals do not develop symptoms until the aneurysm becomes very large or actually just bursts. So they can happen suddenly without any warning with the aneurysm. So that's kind of the tough thing with that. Sometimes people don't even realize that they have them, and then they end up bursting and then causing problems or even death. Headaches are another nervous system pathology, and there's various types of headaches caused by many things. So we look at migraine headaches. So one of the things when you're looking at different types of headaches, kind of see like how they present, like where the pain is. So for instance, migraine headaches are unilateral. So typically when people get migraines, they feel it only on one side of the head. And migraines are caused by various things. Alterations in serotonin, inflammatory issues, hormones many times are responsible for these. One of the things to look at in people who suffer migraines is to look for their triggers. So things that would actually produce migraines, so lack of sleep, smoking, alcohol are all different things that could promote migraines. Cluster headaches are another type of headache. They're unilateral. They tend to present many times like around the eye on one side. Again, things that could cause this: psycho-emotional stress, alcohol, tobacco use. Many times they're also, again, neurovascularly related. Hormones can do these as well. So, and again, these usually present closer to around the eye, where the migraine many times is up more towards the head. Then you have your toxic vascular headaches, which are typically more diffuse. So, I mean, it's kind of just spread out around the head area. These are caused many times by infection, withdrawal or abuse of caffeine, alcohol abuse or withdrawal, or any type of hypoglycemia is also another thing that could promote toxic vascular headaches. And then you have straight vascular headaches. Many times it could cause discomfort as well. And many times they're diffuse as well. With these, it's just key to make sure that the person, if a person has a headache, as long as they're awake, they're alert, they don't have any major fevers or anything like that, many times these are just more or less very benign, but you just have to check for those issues. So looking at some of the issues related to brain trauma, a very common thing, and you hear about it a lot, are concussions. And, just some things to note about concussions. So concussions are a transient disturbance in neurologic function. So concussions are more of a functional injury versus a structural injury. So what you have with concussion is, after a blow to the head, there are cellular and metabolic things going on with the brain that you can't necessarily visualize with diagnostic imaging. So if people just have a concussion and they go and get imaging done, you're really not going to see much of anything, because again, it's more of a functional type of injury. The type of concussions that you have what's called a coup or a contra coup. A coup is when the injury happens on the side of impact. So this is when a moving object strikes the head, versus a contra coup, which is when the head strikes a stationary object. Okay, so now in this instance, the head's moving. So like a prime example, this would be someone who falls on the floor and hits their head on the floor. And what happens here is that the brain actually shifts and strikes the skull on the opposite side. So the injury actually happens on the opposite side. Some things to kind of note about concussions are that there are different types of signs and symptoms based upon the different aspects of concussion. So you have physical symptoms, you have cognitive, you have behavioral, and you have sleep-related. So those are all, and it's going to be important to know which symptoms kind of fit into those categories. So table 13.9 in your book has a table kind of illustrating those. It's very important that particularly after a concussion where a loss of consciousness occurs, that you reevaluate that person more often. We're going to talk on the next coming slides some of the issues related to classifying concussions and what those classifications mean. So at the time I initially made this lecture, there were at least 16 different concussion guidelines, I believe, according to your textbook, which is a newer edition. Now they now have up to 25 or 26. So it can be a little confusing when you're coming up with return to play protocols. So one of the things practice-wise you can do is, in conjunction with your team physician, come up with a plan. And for the most part, as far as grading concussions, you're just more or less going to manage them based upon the way their symptoms present. So they have to be case dependent. You can't make your management so strict based on just regular grades of concussion, because they all present very differently. So there is a gradual return to play protocol that for the most part is pretty effective. And it basically begins with obviously no activity, which is basically just, rest for the most part. And early on, it's really important that the rest entails like complete rest of the brain. So that's no video games, even like television watching sometimes could be a little much. I mean, it has to be pretty much pure rest. And then you progress. Table 13.11 in your text goes through the different stages of rehabilitation that would be a part of the management of this. So that's your gradual return to play protocol. Another thing to note are delayed symptoms that would warrant emergency transport. So things like worsening headaches, deteriorating mental status, seizures, drowsiness, increased confusion. Your textbook says repeated vomiting. I would tell you this right now, a person would vomit one time with me and I would refer them immediately. So that's important to note. So I would just say vomiting in general. I wouldn't even necessarily look for repeated vomiting. Balance deterioration, slurred speech, weakness in the arms, legs, or being unable to recognize people. And those are listed in your textbook as well, so you don't necessarily have to write them all down from here, but I'm just kind of making note of what would be, because those would be really important. And many times the fear is with concussions is that there's something more than the concussion that actually happened with the trauma, which are going to be some of the things we're going to be talking about later. So the big concern is that there might be a bleed, which is another pathology that could have some more serious consequences. So the epidural and subdural hematomas are some of the things we do get concerned about whenever someone has a head injury. So these are both ruptures of brain vessels. So you have to look at, when you look at what is actually occurring, you have either epidural bleeding or subdural bleeding. So if you look at the picture on the slides, it kind of denotes, we'll discuss these anatomical structures in class, but it basically is just where the bleeding is dependent upon where the damage has taken place. The epidural bleeding is arterial bleeding between the dura mater and the skull. The subdural is venous bleeding between the brain and the dura mater. So what you end up dealing with here, so obviously an arterial bleed is going to happen a lot faster. So with an epidural hematoma, the symptoms will usually develop much more rapidly, whereas a subdural hematoma will typically have symptoms that don't show up for a little while. In both instances, either one of them, you might not get signs and symptoms for up to 24 hours. So it's important to kind of note that, you know, sometimes this can be delayed. Many times if a patient is not recovering from their concussion within a week or two, physicians will usually order some type of imaging to make sure that they do not have, and in that instance it would be a subdural, because the bleeding will occur much more slowly because of normally what's going to be damaged there are more venous structures as opposed to the epidural, which will be arterial. Post-concussion syndrome is something that could come about as a result of concussion. So this is basically when the signs and symptoms of a concussion get prolonged, and some of the noted things that commonly get prolonged are up here. There are specific criteria for diagnosing this. So usually what it requires is symptoms from 3 different categories within 4 weeks of the concussion. And table 1312 lists those in your textbook. Very important that the person gets evaluated by the physician, more specifically in this case many times it will be a neurologist for definitive diagnosis. And usually, as I had stated previously when talking about the 2 different types of bleeds that occur, that will be ruled out as well, and it'll likely be ruled out within a week or 2 if the person has some symptoms. The important thing is that all vigorous activity has to be completely resolved. So this could take a while. Sometimes this could last up to a year, just depending upon how bad the individual's concussion was, and sometimes what can impact that is how many concussions that they had previously. Second impact syndrome is something that happens as a result to a blow to the head before the first concussion has resolved. So this is one of the main things you get concerned about that could happen if the individual gets a second blow to the head, and it could be a blow to the head that is not as severe as the initial one was before all of their symptoms have resolved. So that's why it's very important to make sure that both symptoms at rest and with exertion are all clear before the individual goes back to play. What essentially happens with this is you get a disrupted autoregulation of blood flow to the brain. Basically what that means is that obviously there's a certain amount of blood flow you want to the brain, obviously to keep the function, to keep circulation to that area. What happens here is that basically what controls the amount of blood flow basically ends up getting messed up with the second blow to the head, and basically the brain gets engorged with blood, and you start to even get, you see in the picture here, an actual herniation of the brain into the brainstem. And what will happen with this many times is an individual, you'll see very quick deterioration of neurologic function, and in most instances the individual will die from this. If an individual does survive, they will have very significant long-term disabilities if they do survive this. So very important to make sure that an individual does fully recover from the signs and symptoms of a concussion and goes through a protocol before they go back into activity. Meningitis, or there are different types of neurological infections. So these are basically infections that cause inflammation of the meninges. So we've gone over the meninges earlier. So basically the covering of the central nervous system. What basically happens is, and many times you're looking at a bacterial cause or a viral cause. Either the bacteria or the virus enters through the bloodstream and basically causes the inflammation. And because the central nervous system does not have many immune defenses, particularly in the case of a bacterial meningitis, the bacteria replicates pretty quickly. So that could cause a lot of problems. Acute bacterial meningitis can actually be fatal. Viral meningitis is not quite as contagious, and it's not as quite as aggressive as the bacterial meningitis. There are other types of meningitis. You can get meningitis from certain drugs, lead poisoning. There's actually parasitic versions of meningitis. All of them are typically less severe. Your most severe form of meningitis is going to be bacterial meningitis. That's usually what's going to be the most aggressive and is also the most contagious of the type. So for each of the types in your management, note how, note how contagious they are and what are some of the different signs and symptoms you would see.